looking at the superior laryngeal nerve and the internal and external portions, we must now determine why these are named internal and external. So the internal and external branches off the superior laryngeal nerve off of vagus are named that way based off primarily the thyrohyoid membrane. So whenever we think about the thyroid cartilage, we can think about it like this. And then we can come back with our hyoid bone, quickly drawn one. And in between these, we have the thyrohyoid membrane. So it's a membranous structure. And what's unique about these two branches off the superior laryngeal nerve off vagus is that they are named in relation to that thyrohyoid membrane. The internal branch of the superior laryngeal nerve off vagus is actually going to pierce this membrane, whereas the external is going to stay outside of it. But the internal laryngeal nerve, which is a branch of the superior laryngeal nerve off vagus, which I keep saying because it's important to note, does not travel alone. It actually travels with an arterial structure. And so the internal laryngeal nerve off the superior laryngeal off vagus is going to travel with the superior laryngeal artery. And that superior laryngeal artery is going to be a branch off the superior thyroid artery. And that superior thyroid artery is one of the first branches, well, it is the first branch of the external carotid artery, which is one of the vessels that the common carotid artery bifurcates into, with the other being the internal carotid artery. The internal carotid artery bears the name internal because it has no branches until it enters the skull, whereas the external carotid artery has about 8 branches and stays external to the skull, hence external and internal divisions of the common carotid artery. The right common carotid artery is derived off the brachiocephalic trunk, just as that right subclavian that's associated with the right recurrent laryngeal nerve is, and the left common carotid artery is actually a direct branch off the aortic arch. So the superior laryngeal artery doesn't directly run with the superior laryngeal nerve, but it runs with the branch of it. And the branch that it runs with pierces the thyrohyoid membrane and is therefore called the internal laryngeal nerve.